And this lecture is going to cover psychosocial. So we're going to talk about the parent-infant relationships, bonding, and acquaintance. So talking about the processes. So the actual process by which a parent comes to love and accept a child, and a child comes to love and accept a parent, is known as attachment. Attachment occurs through the process of bonding. So attachment and bonding, as far as terms go, can be used interchangeably. Attachment is developed and maintained by proximity and interaction with the infant, through which the parent becomes acquainted with the infant, identifies the infant as an individual, and claims the infant as a member of the family. The concept of attachment includes mutuality. That is, the infant's behaviors and characteristics elicit a corresponding set of parental behaviors and characteristics. Okay? The infant will display signaling behaviors such as crying, smiling, and cooing that initiate the contact and bring the caregiver to the child. An important part of attachment is acquaintance. Parents use eye contact, touching, talking, and exploring to become acquainted with their infant during the immediate postpartum period. Adoptive parents undergo the same process when they first meet their new child. During the period, families engage in the claiming process, which is the identification of the new baby . One of the most important areas of assessment is careful observation of specific behaviors thought to indicate the formation of emotional bonds between a newborn and the family, especially the mother. Assessment of parent-infant attachment relies on a more skillful observation and interviewing. A rooming in of the mother and the infant, and liberal visiting privileges for fathers, partners, siblings, and grandparents provides nurses with excellent opportunities to observe the interactions and identify behaviors that demonstrate positive or negative attachment. Attachment behaviors are easily observed during feeding sessions. Early close contact can facilitate the attachment process between a parent and child. Although a delay in contact does not necessarily mean that attachment will be inhibited, additional psychologic energy can be necessary to achieve the same effect. To date, there's no scientific evidence to demonstrate that immediate contact after birth is essential for the human parent-child relationship. Early skin-to-skin contact between the mother and the newborn immediately after birth and during the first hour facilitates maternal, affectionate, and attachment behaviors. Okay. To do this, the newborn is placed in the prone position on the mother's bare chest. The baby and mother are covered with a warm blanket, and a cap is placed on the infant's head to prevent heat loss. This practice also promotes early and effective breastfeeding and increases the breastfeeding duration. It is also associated with less infant crying, improved thermoregulation, and improved cardiorespiratory stability in late preterm infants. Extended contact talks about couplet care or rooming in. So rooming in is a type of family-centered care. With this practice, the infant stays in the room with the mother. In some facilities, the newborn never leaves the mother's presence. Nurses perform all assessments and care in the room with the parents. Nurses encourage the father or partner to actively participate in caring for the infant. They can also encourage siblings and grandparents to visit and become acquainted with the infant. The parent-infant relationship is strengthened through the use of sensual responses and abilities by both partners in the interaction. The nurse should keep in mind that cultural variations are often seen in interactive behaviors. So we have the senses involved in communication. Touch, or the tactile sense, is used extensively by parents as a means of becoming acquainted with the newborn. Many mothers reach out for their infants as soon as they are born. Mothers lift their infants to their breasts, enfold them in their arms, and cradle them. Okay. Once the infant's close, the mother begins the exploration process with her fingertips, one of the most touch-sensitive areas of the body. Touching behaviors by mothers vary in different cultural groups. For example, minimal touching and cuddling is a traditional Southeast Asian practice thought to protect the infant from evil spirits. Eye contact. Parents repeatedly demonstrate interest in having eye contact with the baby. Some mothers remark that once their babies have looked at them, they feel so much closer to them. Parents are intent on getting their babies to open their eyes and look at them. In North American culture, eye contact appears to reinforce the development of a trusting relationship and is an important factor in human relationships of all ages. In other cultures, eye contact is perceived differently. For voice, the shared response of parents and infants to each other's voices is remarkable. Parents wait tensely for the first cry. Once that cry has reassured them of the baby's health, they begin comforting behaviors. As parents speak, the infant is alerted and turns toward them. Infants respond to higher-pitched voices and can distinguish their mother's voice from others soon after birth. And scent. So another behavior shared by parents and infants is a response to each other's odor or scent. Mothers comment on the smell of their babies when first born and have noted that each infant has a unique scent. Infants learn rapidly to distinguish the smell of their own mother's breast milk. Newborns move in time with the structure of adult speech, which is termed entrainment. They wave their arms, lift their heads, kick their legs, which looks like they're dancing in tune to a parent's voice. Culturally determined rhythms of speech are ingrained in the infant long before he or she uses spoken language to communicate. This shared rhythm gives the parent positive feedback and establishes a positive setting for effective communication. Biorhythmicity refers to the infant being in tune with the mother's natural rhythms. The mother's heartbeat or a recording of a heartbeat can soothe a crying infant. One of the newborn's tasks is to establish a personal biorhythm. Parents can help in the process by giving consistent, loving care and using their infant's alert state to develop responsive behavior and increase social interactions and opportunities for learning. Reciprocity and synchrony. So reciprocity is a type of body movement or behavior that provides the observer with cues. The observer or receiver interprets those cues and responds to them. It can take several weeks to develop in a new baby. For example, when the newborn fusses and cries, the mother responds by picking up and cradling the infant. The baby becomes quiet and alert and establishes eye contact, and the mother verbalizes, sings, and coos with the baby maintaining eye contact. The term synchrony refers to the fit between the infant's cues and the parent's response. When parent and infant experience a synchronous interaction, it is mutually rewarding. Parents need time to learn to interpret the infant's cues correctly. For example, the infant develops a specific cry in response to different situations, such as boredom, loneliness, hunger, and discomfort. After birth, adaptation involves stabilizing tasks, coming to terms with commitments. Parents demonstrate growing competence in child care activities and become increasingly more attuned to their infant's behavior. So we have what's called a transition to parenthood. The current perspective is that parenthood is a developmental transition. The transition to parenthood is a time of disorder and disequilibrium, as well as satisfaction and joy for mothers and their partners. Usual methods of coping often seem ineffective, and some parents are so distressed that they're unable to be supportive of each other. Because men typically identify their spouses or partners as their primary or only source of support, the transition can be comparatively harder for fathers. They often feel deprived when the mothers who are also experiencing stress cannot provide their usual level of support. Many parents are unprepared for the strong emotions such as helplessness, inadequacy, and anger that arise when dealing with a crying infant. However, the parenthood role allows adults to develop and display a selfless, warm, and caring side of themselves that may not otherwise be expressed. Parental tasks and responsibilities. So parents need to reconcile the actual child with the fantasy and dream child. This process means coming to terms with the infant's physical appearance, sex, innate temperament, and physical status. If the real child differs greatly from the fantasy child, some parents delay the acceptance of the child, and in some instances, they never accept the child. For the mother, she has to go through Reva Rubin's stages of becoming a mother. There are 3 phases of maternal role attainment as the mother is adjusting to her new parental role. Okay. Additionally, we have Mercer, who suggested that the concept of maternal role attainment be replaced with becoming a mother to signify the transformation and growth of the mother's identity. Becoming a mother implies more than attaining a role. It includes learning new skills and increasing her confidence in herself as she meets new challenges in caring for her child or children. Maternal sensitivity or maternal responsiveness is an important determinant of the maternal-infant relationship. It can be defined as the quality of a mother's sensitive behaviors that are based on her awareness, perception, and responsiveness to infant cues and behaviors. Maternal sensitivity significantly influences the infant's physical, psychologic, and cognitive development. Maternal sensitivity develops over time in a reciprocal give-and-take relationship with that infant. The postpartum blues is a completely normal experience that occurs in 50 to 80% of women of all ethnicities and races. In the baby blues, women are emotionally labile, and they often cry easily for no apparent reason. This seems to peak around the 5th day and subsides by the 10th day. Other symptoms include depression, a letdown feeling, restlessness, fatigue, insomnia, headache, anxiety, sadness, and anger. Biochemical, psychological, social, and cultural factors are potential causes of the postpartum blues. Regardless, we need to let the mom know that this is a normal process and that it doesn't mean that she is going to develop any negative coping such as postpartum depression. Now, beyond the blues is when mom experiences deep depression, and is no longer able to care for herself or the infant, and she's very disinterested. And this would mean that she's showing signs of postpartum depression. Okay? Postpartum depression is a maladjustment that you'll talk about more in your high-risk course. Okay? This chart is showing you Riva-Rubin's stages of maternal adjustment. So first phase is the taking in phase. Typically lasts for the first 1 to 2 days. It's very focused on self. Okay, so mom is focused on herself, on what she went through, her pain, feeding herself, and her needs. And then around the 2nd or 3rd day, we should have the taking hold phase. So in taking hold phase, then mom is more interested in the care of the baby. This is the perfect time to really teach newborn care. Mom's very eager to learn and practice, okay? Although she could still have those baby blues periods. And then finally, the letting go phase. So this is moving forward as a family, as a whole family unit. There are factors that influence the psychosocial adaptation. This could be your client's age, multiparity, social support, absence of a partner, socioeconomic status, and any abnormal situations. In becoming a father, we do have some predictable phases of paternal transition. First, they enter parenthood with intentions of being an emotionally involved father. They confront reality, realizing the expectations were inconsistent with realities of life with the newborn during the first few weeks. Then they work to create the role of an involved father, and then they reap the rewards. Okay? The most significant being reciprocity from the infant, such as a smile. The term used for the father's absorption, preoccupation, and interest in the infant is called engrossment. Characteristics of engrossment include some of the sensual responses relating to touch and eye-to-eye contact, and the father's keen awareness of features both unique and similar to himself that validate his claim to the infant. The father feels strong attraction to the newborn and can spend considerable time communicating with the infant and taking delight in the infant's response to them. It is possible and likely that your fathers receive less interpersonal and professional support compared to mothers, and they can feel excluded from prenatal appointments and perinatal classes. They need information and encouragement during pregnancy and in postpartum period related to infant care, parenting, and relationship changes. During the postpartum stay, nurses can arrange to teach infant care when the father is present and provide anticipatory guidance for fathers about the transition to parenthood. The transition to parenthood brings about changes in the relationship between the mother and her partner. A strong, healthy marriage or couple relationship is the best foundation for parenthood, although even the best relationships are often shaken with the addition of a new baby. During the first few weeks, parents experience many emotions. Even though they may feel an overwhelming love and sense of amazement towards their newborn, they can also feel a great responsibility. Common issues couples face as they become parents include changes in their relationship with one another, division of household and infant care responsibilities, financial concerns, balancing work and parental responsibilities, and social activities. Couples need to schedule time into their busy lives for one-on-one conversation and have regular dates or time away from the infant. Nurses can provide opportunities for parents to discuss concerns and ask questions about resuming sexual intimacy. The couple may begin to engage in intercourse during the 2nd to 4th week after the baby is born. Some couples begin earlier as soon as it can be accomplished without discomfort, depending on factors such as timing and vaginal dryness. Sexual intimacy enhances the adult aspect of the family, and the adult pair shares a closeness denied to other family members. Infant-parent adjustment looks at the behavioral characteristics of the infant influencing parenting behaviors. First is rhythm. To modulate rhythm, both parent and infant must be able to interact. The infant must be in an alert state, which is one of the most difficult of the sleep-wake states to maintain. The parent must work hard to help the infant maintain an alert state long enough and open enough for interactions to take place. Behavioral repertoires. Both the infant and the parent have a repertoire of behaviors that they can use to facilitate interactions. Mothers and fathers engage in these behaviors depending on the extent of contact and caregiving of the infant. Nurses can teach parents to recognize, interpret, and respond to infant behaviors. For infants, their repertoire includes gazing, vocalizing, and facial expressions. The parent's repertoire includes various types of interactive behaviors, such as constantly looking at the infant and noting the infant's response. And responsivity. Contingent responses are those that occur within a specific time and are similar to form of stimulus behavior. The adult has the feeling of having an influence on the interaction. Infant behaviors such as smiling, cooing, and sustained eye contact usually are viewed as contingent responses. So factors that can influence the transition to parenthood include age, especially adolescence. So for the adolescent mother, although becoming a parent is biologically possible for an adolescent female, her egocentricity and concrete thinking often interfere with the ability to parent effectively. Adolescent mothers are more likely to give birth to preterm and/or low birth weight infants. Mortality rates are higher among infants of adolescent mothers. This can be related to inherent problems associated with preterm birth or other conditions, but it's influenced by mothers' inexperience, lack of knowledge, and immaturity. The transition to parenthood can be difficult for adolescents. Because many adolescents have their own unmet developmental needs, coping with developmental tasks of parenthood is often difficult. Some young parents experience difficulty accepting a changing self-image and adjusting to new roles related to the responsibilities of infant care. Adolescent mothers are at an increased risk for postpartum depression, which is often associated with a lack of social support and poorer relationships with their partner. There is an increased risk of child abuse and neglect by adolescent mothers. The risk increases when the mothers experienced abuse as a child. The adolescent father and mother face immediately immediate developmental tasks that include completing the developmental tasks of adolescence, making a transition to parenthood, and sometimes adapting to marriage. The nurse can initiate interaction with an adolescent father during prenatal visits, labor, birth, and postpartum hospitalization. The nurse can assess the relationship between the two adolescents and encourage them to discuss their plans for the father's involvement with the mother and infant after birth. During the hospital stay, the nurse can include the adolescent father in teaching sessions about infant care and parenting. Adolescent fathers need support to discuss their emotional responses to pregnancy, birth, and fatherhood. The nurse needs to be aware of the father's feelings of guilt, powerlessness, or bravado, because these can have negative consequences on both the parents and the child. Advanced maternal age, which is women that are older than 35, need support from their partners to adjust to being an older mother and the changes that are involved in becoming a parent and seeing themselves as competent. Older mothers may have less family and social support than younger mothers. They are less likely to live near family, and their own parents may be unable to provide assistance or support because of age or health issues. Other influences on the transition to parenthood, your same-sex couples. When the couple consists of two women or two men, issues such as a lack of family acceptance and support, public ignorance, and social and legal invisibility influence the ability to adapt as new parents. Attitudes of healthcare professionals can either positively or negatively affect the care provided to same-sex couples. Social support is strongly related to positive adaptation by new parents during the transition to parenthood. Social support is multidimensional, includes the number of members in a person's social network, types of support, perceived general support, actual support received, and satisfaction with support available and received. Cultural beliefs and practices are important determinants of parenting behaviors. Cultural influences the interactions with the baby as well as the parents or the family's caregiving style. All cultures place importance on desiring and valuing children. Knowledge of cultural beliefs can help the nurse make more accurate assessments and analyses of observed parenting behaviors. Cultural beliefs and values give perspective to the meaning of childbirth for a new mother. Nurses can provide an opportunity for a new mother to talk about her perception of the meaning of childbearing. Socioeconomic conditions often determine access to available resources. Parents whose economic condition is made worse with the birth of each child and who are unable to use effective methods of fertility management can find birth complicated by concern for their own health and a sense of helplessness. Mothers who are single, separated, or divorced, or without a partner, family, and friends can view the birth of a child with dread. There can be serious financial problems. Personal aspirations. For some women, parenthood interferes with or blocks plans for personal freedom or career advancement. Unresolved resentment affects caregiving activities and adjustment to parenting. The situation can result in indifference and neglect of the infant or in excessive concerns. The mother may set impossibly high standards for her own behavior and the child's performance. In early interactions between a parent and child, each one uses all of their senses to initiate and sustain the attachment process. A parent who has an impairment of one or more of the senses needs to maximize use of the remaining senses. Mothers with disabilities tend to value the importance of performing parenting tasks in a perceived culturally usual way. In the visually impaired parent, this alone does not have a negative effect on early parenting experiences. These parents, just as sighted parents, express the wonders of parenthood and encourage other visually impaired people to become parents. They initially can feel pressure to conform to traditional sighted ways of parenting, but they will adapt and develop methods better suited to themselves. Examples of activities that visually impaired parents perform differently include preparation of the infant's nursery, clothes, and supplies. For the hearing impaired patient, a parent who has a hearing impairment faces challenges in caregiving and parenting, particularly if the deafness dates from birth or early childhood. When hearing impaired, they are likely to have established an independent household. Devices that transform sounds into light flashes can be placed in the infant's room to permit immediate detection of crying. Even if the parent is not speech trained, vocalizing can serve as both a stimulus and a response to the infant's early vocalizing. Deaf parents can provide additional vocal training by use of recordings and televisions so that from birth the child is aware of a full range of human voice. Section 504 of the Rehabilitation Act of 1973 requires hospitals to use various communication devices and resources with the deaf, including having staff members or certified interpreters proficient in sign language. Because the family is an interactive open unit, the addition of a new family member affects everyone in the family. Siblings have to assume new positions within the family hierarchy. Parents often face the task of caring for the neonate while also attending to the needs of the other children and attempting to distribute attention equitably. Reactions of siblings result from the temporary separation from the mother, changes in the mother or father's behavior, or the infant coming home. Positive behavioral changes of siblings include interest in and concern for the baby and increased independence. However, sometimes regression in toileting and sleep habits, aggression toward the baby, and increased seeking of attention and whining can be examples of negative behaviors. Because the baby absorbs the time and attention of the important people in the other children's lives, jealousy or sibling rivalry is common once the initial excitement of having a new baby in the home is over. Sibling preparation classes can help the child to adjust. Also, older children may be actively involved in preparing for the infant. Siblings demonstrate acquaintance behaviors with the newborn. The acquaintance process depends on the information given to the child before the baby is born and on the child's cognitive and developmental levels. Initial behaviors of siblings with newborns include looking at the infant and touching the head. The initial adjustment of older children to a newborn takes time, and parents should allow children to interact at their own pace rather than forcing them to interact. Grandparent adaptation. So, becoming a grandparent is most often associated with great joy and happiness. Okay? They experience emotions as the pregnancy and therefore birth contribute to family continuity. Pregnancy and birth necessitate redefining the intergenerational roles and relationships within the family. A primary role of grandparents is to support, nurture, and empower their children in the parenting role. Grandparents must acknowledge that things have changed since they first became parents as they deal with changes in practices and attitudes towards pregnancy, birth, child rearing, and men's and women's roles at home and in the workplace. Involvement of the grandparent depends on cultural and familial factors. So in the care management, there are numerous changes that are occurring during the first few weeks of parenthood. Nursing care management should be directed toward helping parents cope with infant care, role changes, altered lifestyle, and a change in family structure resulting from the addition of a new baby. Now, some things the nurse can do can be to provide opportunities for parent-infant interaction, implement strategies to facilitate sibling acceptance of the infant, provide practical suggestions for infant care, provide anticipatory guidance on what to expect as the infant grows and develops, provide positive reinforcement for loving and nurturing behaviors with the infant, and closely monitor parents who interact in an inappropriate or abusive way with their infants, and notify an appropriate mental health practitioner or professional social worker.